Hi, my name is Claudia. Today we're going to talk about the importance of proper body mechanics when lifting and bending among the nursing population. The healthcare workers are among the highest ranking professions with musculoskeletal conditions associated with their job. 48% of injuries in hospitals are associated with motions such as lifting, bending, or reaching, which nurses do a lot of. Nurses are often required to help in the transportation of patients, transfers, and carrying out medical equipment. Today, we're going to cover some tips to reduce the risk of low back injury while at work.
Hi, my name is Nick. Before we attempt any sort of lifting, bending, or transfers, I just want to go over maintaining a proper, clean workspace and making sure you're prepared for what you're about to do. Before performing the transfer or lift, a few things you want to make sure of. Core stability is the name of the game. Also, you want to make sure that you're sitting your hips back, keeping your chest up with a wide base of support, and keeping the object or person as close to you as possible. When performing any sort of lift of equipment off the floor, you want to make sure of a few things. You want to get yourself nice and low, sitting your hips back, bringing the object as close to you as possible, reaching underneath, keeping the chest tall, push down through your legs, and lift up. Some things that you want to avoid when lifting an object off the floor or transferring a patient are like this. We don't want you to bend at the hips. We don't want you to round the spine, and we don't like it when you reach out in front of you to lift up an object. These types of things might cause injury. When requiring an object to pick up off the floor and turn with it, remember these few things. Same thing, sitting back, bringing the object close to you, lifting up through the legs. But when you turn, we don't want you to turn with your body. Pivot with your feet instead. When maneuvering a patient in a wheelchair or a bed, remember these few things. Keep your core stable, keep your chest up, bring the patient or bed as close to you as possible, and push through your legs, not through your arms.
I'm Scott. I'm a student physical therapist here at Mercy College, and I'm going to show you a proper stand pivot transfer. So the first thing you want to do is to have the patient scoot forward in the chair. Next thing, you want to make sure your body is in good position. So you're going to bend at the knees, chest up, get as close to the patient as you can. Don't be afraid to get up close and personal. And you're going to have the patient shift forward. I usually do a count of 3. 1, 2, 3. Stand up. Good. Make sure you're squeezing your abdominals as you're doing this. A little weight shift. Good. Good. Do you feel the mat behind you?
Yes.
Good. Reach behind you. Bend your knees as you sit with the patient. Chest out. Make sure you're squeezing your abdominals. For bed mobility, you want to utilize the same concepts that we use throughout the stand pivot transfer. So first thing you want to do is have the patient scooch towards the side of the bed. Next, you want to get as close to the bed as possible. Bend your knees, engaging your core, while removing the patient's legs and simultaneously lifting their trunk and supporting their trunk as they sit.
All right, we're going to get started with some strengthening exercises for your core. Research says that the stronger the core is, the lower the likelihood for lower back injuries are while at work. So right now we're going to have you lie on your back. You can do these exercises in the morning while you're still in bed before you get started for your day. It's very functional and practical. While you are here, you're going to find your navel, move about 3 inches out, 2 inches down until you feel the 2 little bumps in the front of your hips there. Perfect. Now use your 2 listening fingers. From here, move 1 inch down, 1 inch in to find your transverse abdominis muscle. Now to activate this muscle, we're going to do a very small contraction, pushing your back flat into the table. Now you're gonna try to do a 10% contraction. So we wanna do a full contraction first, then bring it down to 10% to activate and finally find that muscle. Once you do feel the muscle twitching between your fingers, you're going to hold 10 seconds. Breathe in and out while you do that. Do not hold your breath. And once the 10 seconds are up, you're going to relax. You can repeat this 10 times, 10-second contractions right before you get out of bed. Moving up, we're going to do some exercises to target the muscles on the side of your hip in order to increase overall hip stability. So you're going to now turn onto your side. You can keep your bottom leg bent in order to increase stability. Top leg is going to be straight, foot flexed. You want to bring it a little bit back, maintaining your abdominals tight and preventing your back from arching all the way back. So once you're here, once again, you want to make sure your quads are activated. You're squeezing all those ab muscles on those glutes. Lift 4 to 5 inches. Hold a second or two. Bring it slowly back down in a controlled manner. Once again, you're going to have the knees straight, quads activated, foot flexed, back as neutral as you're able to have it. Lift 4 to 5 inches off the table. Hold a second or two. Bring it slowly back down. You're going to do this 10 times. Repeat 3 sets, and you're going to do 3 sets of 10 on both sides. Last but not least, let's work on some stretches to loosen up those muscles that you've just worked out. We're going to start with some front rotations while laying on your back. Feet flat on the table, knees bent. You're going to bring both knees slowly side to side in a controlled manner, feeling those side muscles stretch as you move. You're going to do 3 sets of 10 for this nice active stretch. Next up, you're going to hold underneath your knee with both hands. If you're not able to, you can use a wrapped towel or a t-shirt to help you hold underneath the knee. Pull up toward your chest, making sure you're breathing normally. Hold for 30 seconds and repeat 3 times for each leg. All right, to recap, we went over some strengthening exercises for the core and hips, as well as some active stretching. Make sure you try to do this at least once a day to keep up with your mobility and strength.
A few tips and tricks before we send you off. Know your limits. If you need help, get the help. Maintain that core stability with all motions. Avoid that bending at the hip, rounding of the spine, especially in combination with twisting motions, as it can cause injury. If you use the techniques that we gave you today, it should set you up for success in the future.